The hardest things I think is to be away from my family, my husband, especially that I was pregnant, barely having a baby. But being here now, I think it's a good thing. I never came to a rehab. This is my first time.
It's just so much stigma attached, when in fact, opioid substance use disorder is a chronic disease.
This is Alyssa and her daughter Aaliyah. Today is kind of special because today Aaliyah is 3 months old. That also means today they've been in the NOS residential treatment program for 2 months and 3 weeks.
Next week will be my last week here. It's gonna be hard, and I'm gonna have to face a lot of people and my family, and it's gonna be different.
NOS stands for neonatal abstinence syndrome. It refers to health problems that develop in the womb when the mother uses opiates. Aaliyah wasn't born with NOS, but Alyssa did use drugs during her pregnancy.
Well, I started using when I was 13, and then it led to cocaine, pills, and I was pregnant at the time, so I would tell myself, no, I can't use, but I would still use. Or I had that thought in the back of my mind, I want to get high, and I would try not to think about it so much, but it was always there, and I would get high, it was just an everyday thing. I was always sad, mad at the fact that I did use, if I did use that day. I just wasn't happy.
Alyssa, came to us very broken and just didn't have a lot of hope that things could get better. She was timid and shy and guarded, of course. Anyone who comes in here with legal issues and previous CPS involvement, pregnant, is going to be very fearful and afraid to open up and share, and afraid that what she says may be used against her.
The residential program in San Antonio is a pilot program funded in response to the high number of babies born addicted to drugs. The need for the program dovetailed with results from a recent study. A lot of mothers in Texas were dying from overdoses. This brings us to Dr. Ollier.
I'm the chair of the Department of State Health Services Maternal Mortality and Morbidity Task Force.
The task force was created in 2013 after medical experts noticed a spike in maternal mortality rates. From 2006 to 2010, the rate was 18.6%. That rate jumped to 34.5% over the next 5 years. Researchers point out the numbers are likely a little high due to misreporting on death certificates. But even factoring that in, the rate of mothers dying still jumped significantly, over 35%, between those 5-year averages. That puts the maternal mortality rate in Texas ahead of all developed countries. While there are a lot of factors at play, a crucial one is the country's current opioid crisis.
And we identified in that initial report drug overdose as the second leading cause of death. So among the drug overdose deaths, opioids were the most common contributor to the drug overdose deaths. We think that this represents the problem that we're seeing nationwide. Our country right now is in the midst of what we call an opioid epidemic. And with all of the increase in the use, we think that this is contributing to the higher maternal mortality rate. And certainly the same thing is being seen in other states as well.
We saw an increase in women accessing services. So historically, our clinic has always been 70% males, 30% females. Well, guess what? As of right now, I can tell you we are at 62% female. So it really did a shift.
Breseda Courtois is the Director of Substance Use Treatment Services with the Center for Healthcare Services in San Antonio. Her Mommy's program has been highlighted as a way to help addicted mothers, but it wasn't started in response to the current opioid epidemic.
San Antonio has had a heroin problem for many years. So when the opioid crisis broke out nationwide, San Antonio had already been living it. We realized that there was a need for gender-specific treatment services, specifically women. Their needs are much more complex because you are talking more of a unit treatment, you're talking children, partners, extended family.
Many of the women carry around a lot of guilt and shame of using during their pregnancy. So if baby gets fussy or baby starts to cry, they blame themselves. And so we just kind of reassure them that, baby's going to be okay. Baby is getting treatment. You're here, you're making the right choices. We see the healing in process.
The success of the Mommies program helped kickstart the NOS residential program. They currently house 14 mothers. Women get counseling, parenting classes, medication-assisted treatment for their addiction, plus they can keep their kid with them as they get treatment. They also get a support system, like the one between Alyssa and Alice.
We're taking them to their appointments, we're going with them to their CPS hearings and group conferences and testifying on their behalf and advocating for them, and that's something that the women don't have in their lives.
It's a good relationship. She helped me a lot. She trusts me, and she's a good person. She'll fight for you.
While both the NOS and the Mommies programs have been successful, efforts to duplicate it have been slow. Only a handful of outpatient programs for addicted mothers exist across the state, and the NOS program is the lone residential program in Texas.
I can tell you with significant amount of certainty that there are not enough resources. There are not enough services or programs out there to help. So, do I see the problem growing? Yes.
Alyssa and Aaliyah will soon leave the treatment home. They'll have to face a world that may judge them or try to pull them back into addiction. But they'll face it all together.
It's amazing. It's like I don't even want to leave because I'm going to miss everybody, but I got to start my life out there and be a mother to that little girl because she needs a mom.